Hello, guys. Welcome to another session on community medicine specialist. Myself, Dr. Tushar Kalra. I am MD 30th PG resident in community medicine. So today we'll learn about the functions of community medicine specialist and the competencies that he requires. So let's begin. So functions of specialist in community medicine. So these are identify and prioritize health need of the community. Second one is identify determinants influencing health and diseases. Prioritize and undertake interventions. Plan and organize healthcare delivery services and lead the health team. He should advocate appropriate healthcare services to achieve universal healthcare. Intersectoral coordination with all stakeholders and conduct health system and operational research. So these are some competencies. So competencies for community medicine practice are the competencies basically mean they are abilities and attributes that are essential to effective healthcare delivery. So what are the competencies a community medicine specialist should have is the basic clinical skills, teaching and training, public health management, health system research, leadership and advocacy skills. So we'll see the first clinical competency. So he should be able to diagnose common illness in general practice and manage them effectively with minimum resources available. Identify the additional healthcare needs of a patient with disability and be well informed about the hospital facilities location and availability of specialized care in his area so as to make judicious use of it. He should understand clearly about the integrated approach to meet the need of an individual, a family and a community. The second one is teaching and training competency. He should be there should be community based training in close association with local health system so that a community medicine specialist should be they should be unable to understand the community health issues, and he should acquire the skills to manage the community health issues. So what are the community health issues at a local level? So he should be able to manage the same. He should assess the learning needs of the groups, like when a community medicine specialist, as a community medicine specialist, we go into the field. So in the field, if we have a staff, suppose a community health officer working at Ayushman Bharat Health and Wellness Center, FHW, MPHW. So if he or she lacks certain skills, for example a diagnostic tool, so we have to see to it and manage it properly. So we have to plan a session or training or suggest resources and make them skillful. Third is formulate learning objectives, plan curriculum and prepare curriculum materials, that is medical colleges, select and implement appropriate learning method, evaluate learning experiences. Public health management competency, so he has to identify the groups requiring special attention, including those facing occupational hazards. He has to initiate, implement and supervise the national health programs effectively and responsibly. He has to identify threats to our environment and anticipate. He has to anticipate, prepare and respond to disaster. So disaster management is a competency in community medicine. Plan health manpower development, manage logistic and material effectively, assess cost and carry out program budgeting. So cost is very important in any program, any intervention. It has to be cost effective as much as possible so that we can scale it up. Okay, so next is identify determinants of health and take them into account for planning measures and strategies. Monitor and assure quality in program implementation. Manage health information system and response appropriately to information gathered. Understand and implement public health laws. Establish surveillance system and respond to public health threats efficiently. Now next is research competency. He should acquire skill in research methodology and epidemiology, critically evaluate data, identify gaps in knowledge and formulate research question, design and implement health system research and epidemiological study, analyze data and present finding, effectively communicate findings and public health information, then apply ethical principle to collection, maintenance and use and dissemination of data. So whatever we do, it should be ethically correct in research. Leadership competency, so he has to interact and communicate effectively with people, explain them the scientific information to the public, because public doesn't know the complex words. So a medical person will know a complex words very well, but public, we have to make them understand and make our communication very very effective. And decision makers and opinion leaders, and facilitate intersectoral coordination. Intersectoral coordination is very important. We have to keep the environment safe, so we have to coordinate with various departments, okay, and promote and establish partnerships. My reference for this are IAPSM textbook of community medicine, third edition. Thank you.